By the year 2030, the United States will face an estimated shortage of about 40,000 to 100,000 physicians. This includes the primary care physician, the PCP, whose demand is expected to increase by about 20% due to America's aging population and the expansion of health insurance coverage. Primary care plays a crucial role in our healthcare system, and this shortage has burdened society in a tremendous way. In 2007, the New England Healthcare Institute published a study examining the ineffectiveness of our healthcare system. They stated that the emergency department had become a primary care service for many people, while the healthcare system failed to meet the growing demand for care. This issue is currently on the rise and will continue to increase as access to healthcare is a problem for millions of people around the nation. However, this problem is not due to our system being short-handed. This is due to our system being inefficient with its current resources. We rely too heavily on the physician and not enough on mid-level practitioners such as the nurse practitioner and the physician assistant. One of the most effective and quickest ways to solve this problem is to change the current scope of practice laws and allow mid-level practitioners to become primary care providers, and in turn increase access to primary care throughout the nation. Now, not only will primary care accessibility increase, the cost of services for insurance companies and patients will decrease if change is implemented. In a study comparing the cost of services provided by primary care physicians and nurse practitioners, there was a $207 per beneficiary annual difference. Now, comparing this difference over 10 years, insurance companies could save over $60 million if primary care is provided through nurse practitioners. It has also been proven that nurse practitioners receive and achieve clinical outcomes and patient satisfaction similar to primary care physicians. So if numerous studies and years of research have shown that primary care is equally successful in the hands of mid-level practitioners, why hasn't the shift occurred? The answer is rooted in scope of practice laws, which determine the procedures, treatments, and services that healthcare practitioners can provide based on their licensing. Current scope of practice restrictions have prevented other healthcare practitioners besides the physician from practicing to the full extent of their skills and ability. In fact, nurse practitioners are trained quicker, they cost less than physicians, and are more flexible within the healthcare system. Mid-level practitioners are fully equipped in providing primary care. However, due to the current scope of practice laws, they are unable to do so. Instead, they have to sit back and watch as millions of people within the United States are unable to receive care. These scope of practice laws are a direct cause of the workforce shortage. However, they are also causing an inflation in healthcare costs, which are affecting rural areas significantly. Our healthcare system encourages physicians to practice in higher income areas simply because they are able to receive a high reward by practicing there, leaving areas that need care the most unattended. This is why healthcare reform must be patient-centered. We must change these scope of practice laws and allow nurse practitioners, physician's assistants, and other advanced practitioners to become primary care providers and provide to rural areas across the nation and provide to everyone that needs primary care. The shortage of primary care physicians is an issue that is not going to go away. Change must occur in order for us to meet the needs of healthcare in our population. By altering the current scope of practice laws and allowing mid-level practitioners to become primary care providers, we can provide a more effective, efficient way of providing primary care and making it more accessible. Today is the day that this change must occur. Let us give responsibility to these mid-level practitioners and allow them to become primary care providers because they are fully capable of serving our desperate nation.